Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on rotator cuff muscles group, which is a very weak part of human anatomy, and dislocation of shoulder joint occurs mostly because of this rotator cuff muscles weaker portions. So let us discuss what are these muscles. So as you know that as a group, the rotator cuff muscles are responsible for stabilizing the shoulder joint by providing the fine-tuning movements of the head of the humerus. Rotator cuff is a group of muscles and tendons that keep the shoulder joint stable. These muscles also allow the shoulder to rotate safely. Rotator cuff injuries are common and they can range from chronic inflammation, tears in one or more of the rotator cuff tendons. Your shoulder is a ball and socket joint. The ball is the head of the humerus upper arm bone. It fits into the socket of your shoulder blade. The rotator cuff consists of muscles and tendons that hold the ball in the socket. The rotator cuff allows the shoulder to rotate safely while staying stable. It consists of muscles. We should know that muscles are soft tissues and many stretchy fibers make up your muscles, and you have more than 600 muscles in your body, and different types of muscles have different jobs, and some muscles help you run, jump, or perform delicate tasks like threading or needle. Other muscles allow you to breathe or digest food. Your heart is a hard-working muscle that beats thousands of times a day, and many disorders, injuries, and diseases can affect how muscles work. These conditions can cause muscle pain, muscle spasms, or muscle weakness, and more severe disorders can lead to paralysis. And in heart, it can cause cardiomyopathy, and which makes the heart disease make it difficult for the heart to pump blood throughout the body. And we have musculoskeletal system, and these muscles work with your bones, tendons, and ligaments, and tendons attach skeletal muscles to the bones all over the body. Together they support the weight of your body and help you move. You control these voluntary muscles, and some muscle fibers contract quickly and use short bursts of energy and fast twitches muscles. Other move slowly, such as your back muscles that can help with your posture. Now we would come to the parts of the rotator cuff. What are the parts of rotator cuff? The rotator cuff contains four muscles that are supraspinatus, controls internal rotation and lifting of the arm, and infraspinatus muscle which allows you to externally rotate your arm in the shoulder socket. Then there is teres minor, which is a small muscle that helps rotate your arm. Then the subscapularis muscle which controls arm's abduction, holding your arm out straight away from your body. These muscle starts at the shoulder blade, and tendons, strong bands of tissues, they attach the muscles to the bones, and the tendons wrap around the head of the upper arm bone, forming a cuff that keeps your arm in the shoulder socket. And which muscle is not part of the rotator cuff? The teres major muscle is not part of the rotator cuff, although it is frequently confused with other muscles in the rotator cuff, and the teres major performs similar functions to some of the rotator cuff muscles, and its job is to help with the internal rotation of the arm inside the shoulder socket. Injuries to the teres major muscles are much less common than injuries to the rotator cuff muscles. What causes the problem with the rotator cuff? Age and overuse and injury can lead to inflammation or tear in the rotator cuff tendons, and rotator cuff injuries can be degenerative from wearing down of the tendons over time, or they may be acute, the result of a sudden injury. What are the common rotator cuff injuries? The rotator cuff injuries are very common. The two most frequent injuries are rotator cuff tendinitis and rotator cuff tear. Rotator cuff tendinitis, which is inflammation, often results from repetitive overhead motions such as throwing a ball, swimming, or swinging a racket. An acute injury such as falling or lifting something heavy can tear rotator cuff tendons, but in most cases, rotator cuff tears also occur gradually over time. SVA tendons without thins out and wear down, and blood supply to the shoulder tendons also slows down. As a result, tiny tears do not repair themselves as effectively, and playing a sport or doing a job that requires repetitive overhead motions can also lead to tear over time. How are rotator cuff condition diagnosed? Your provider will begin to a physical exam, including checking your range of motion. If your provider suspects you may have a rotator cuff injury, you will have imaging tests such as X-ray, MRI, or ultrasound. Now, how are rotator cuff conditions treated? Treatment for rotator cuff tendonitis or rotator cuff tear varies depending on the severity of your injury. Minor injuries may heal with simple at-home care such as avoiding activities that cause shoulder pain, applying ice or heat, taking non-steroid anti-inflammatory drugs, NSAIDs, or other medications such as naproxen, diclofenac sodium, ketoprofen, piroxicam, meroxicam, meloxicam, etc., ibuprofen, and indomethacin. For more serious injuries, your provider may recommend one or more of the following as a part of your treatment plan. Physical therapy to strengthen the muscles that support your shoulder joint, steroid injections to reduce the swelling, and surgery to repair torn rotator cuff tendons. How can I help my rotator cuffs healthy? You can take steps to help avoid rotator cuff injuries, including exercises to strengthen your shoulder muscles, gentle stretches to keep the shoulder flexible and increase range of your motion, standing on a step stool or ladder to avoid the prolonged reaching and overhead motions, taking extra care to prevent falls that could injure your shoulder. When to call a doctor? When should I call my doctor about rotator cuff problems? You should call your healthcare provider if you experience pain that keeps you from doing your job or activities you enjoy. Sudden intense shoulder pain, especially after a fall or other injury, pain that makes it uncomfortable to sleep on the affected shoulder, weakness in your shoulder. You may want to ask your healthcare provider, what can I do to strengthen my rotator cuff muscles? When can I return to the activities that caused my rotator cuff injury? How can I treat my rotator cuff injury at home? Will I need surgery to repair my rotator cuff? The muscles and tendons that make up the rotator cuff help keep your shoulder joint stable while allowing it to rotate. Inflammation, tendinitis, and tears are common rotator cuff injuries. Minor rotator cuff injuries can heal with rest, physical therapy, and anti-inflammatory medications. More severe injuries, such as rotator cuff tears, may need surgery. So, this was all about rotator cuff injuries and about rotator cuff muscles. I hope so that this video will be more informative for you. And if you have liked this video, then kindly share this video with other individuals as well, and subscribe to my channel. And have a wonderful nice day. Thank you for listening this video.